One of the things that First Lady Casey DeSantis announced last week is that we're going to be funding research through the Florida Cancer Innovation Fund that specifically will be targeting generic drugs, drugs that for which there may not be a financial incentive for the private sector to make investments in. And one of those that we've heard a lot about in terms of what people are saying in public, really a lot of lay people, some cancer physicians also, is ivermectin and other anti-parasitic drugs too. I mean, it's interesting. I actually had a conversation with Dr. Matlis from Canada over the weekend, and he shared with me his experiences treating thousands of patients. And it's definitely an area that should be investigated further in terms of patients that may benefit from adding, not replacing, but adding something like ivermectin to their chemotherapeutic regimen. Based on, certainly from my conversation here, learning about his experience, it absolutely is something that should be studied further. And we're hoping to be able to study some of that, to fund some of that work through the Florida Cancer Innovation Fund, which is a MAHA initiative.
I'm very excited to learn of the outcomes of this, because something I've come to learn through now 4 or 5 years of looking at our health system and understanding it is that there's a huge disincentive to studying the efficacy of things that are not proprietary, that don't have a patent and so forth. So I'm very excited to find out what will come of these studies which you're going to be running.